motherhood and the challenges they face when it comes to medical care and health. News 4's Justina Latimer has more.
Well, Black Maternal Health Week was officially recognized by the White House last year. However, African-American women have been sharing their stories for many years now. Today, I spoke with one mom who's shedding light on the cause. Ebony Davidson is a new mom. While battling issues with her heart rate, she recently gave birth to a baby boy.
Got to the hospital and it was like stroke level high. And they were having a really hard time getting my blood pressure down. And so they kept giving me medicine, and I was terrified, being pregnant.
She says as a Black woman, she was nervous about care during her pregnancy, especially after encountering providers who have failed to listen in the past.
I think what set my journey apart is that I had a team that I trusted. I trusted them to take care of me. And I know I have not always felt that way. Being under the care of, a provider. And I think that my situation could have gone a lot differently had they not listened to me.
The CDC says nationally, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Variations in quality health care, structural racism, and underlying chronic conditions are just some factors that play a role.
For women in particular, our encounters with the healthcare system often result in gaslighting, such as, oh, you can't be that sick. Oh, it must be your anxiety. Oh, you just had a new baby. All of those excuses when we talk about our shortness of breath or things of that nature. And that is compounded for women of color.
Dr. Graves with St. Thomas Health says listening is key.
There's an acronym that actually my son has come up with for bias and actually overcoming some of that. Observe. Learn to observe and not just listen, but observe what the patient says. Then validate. Say you're short of breath. Yeah, I hear you. Let's talk about that some more. And then have empathy. And the acronym comes out to love.
Instead of judging how someone reacts, like being able to listen and embrace it is a skill that I think all providers should have.
Reporting in Nashville, I'm Justina Latimer.